And also religion. I want to elaborate on it. Most studies found that people with religion or spirituality, to be broader, seem to be able to be much more resilient. And there was another bag of items we call others, that when we interview people, they well, I went through this time, this is what I did. I interviewed a doctor. He told me he was sent to the death railway up in Thailand during the Second World War. So every day they tortured me. I have not enough food. I have dysentery or cholera. I think about my aged mother, my son, my family. That gave me the strength to carry on. And he came back and continued to be a doctor here. So there's something that each of you may have. This list is not the complete list. We don't know everything about resilience, about mental resilience. But we know that there's something else that we can do. If we can do a study, we can do a survey, and then importantly, we do an intervention. This will give us better information about how we can translate our research into something of practical importance to people's life. And when you leave the campus and go to work somewhere else, you can also bring along these techniques. We call it the social DNA. The social DNA that you learn in NUHS, you can go back and tell the workplace, this is what I learned, and just try this in the workplace. You may have seen this picture of this man. Some of you, how many have seen him before? Nobody. So in the newspaper about 3 months ago, he won the Nobel Prize, and he was a lecturer at NUHS. Just before Dr. Sunny News Times in 1947, and his name is Sir James Black. So James came back to Singapore about 15 years ago. I was then the Vice Dean of Medicine, and I was asked by the President at the time, Professor Lim Pin, to take him out together with the Dean for a dinner. And the Dean told me, I'm going to put you on his right side. I said, why? I want to find out how he discover, this new. The only person, Nobel Prize winner, to discover 2 new drugs, not just one, 2. One is propranolol, the other is cimetidine. This is the first time. Find out how this chap is so clever. He can discover 2. One is good enough, got 2. So dinner time, we chat with him. He told us many things. Firstly, he told me that to be a researcher, you cannot be rich. You cannot become rich, by the way. He told us that although he discovered propranolol, which is the drug for hypertension, and the drug company made billions of dollars. It is the single drug that earned the most amount of money for the drug company in the history of medicine. See, I received very little from them. Because they're working for the company. It belongs to the company. So you can't be rich. So Professor Goh Lee Gan, I told him he's the last socialist in town. You can't earn, you'll be a researcher and no money. Secondly, he told us that don't stay in your own foxhole. We stay in medicine, we stay to ourselves. People in science, their own faculty, they work with them because they have different ideas. They think differently. The lawyers are quarrelsome fellows. They think differently from all of us. Mix with them. Bring them into your team. So the third point he told us was, don't be afraid to challenge the orthodoxy. Don't be afraid to tell people that they are wrong. I said, Asians often agree that the authorities are big people. Tell them they are wrong and do something to rectify it. Many years ago, we were doing the World Health Study for Alzheimer's disease and dementia. We were told that the prevalence of dementia is 10%. Full stop. Done by a professor at Cambridge. We did here in Singapore, it's only 3%. Realize it's different. We told the World Health that, and there's interesting studies. And the last thing he told me was very important. What is the elephant in the room? What is the elephant in the room? So he asked me, what are you studying? I said, well, I'm studying Alzheimer's disease. I said, well, that's not common, The common thing in the world, for example, he did the study on hypertension, right? Because hypertension is very common. Then he went and found that people have peptic ulcer, and discovered a drug. He said, these drugs for the ulcers and the heart and the hypertension is because of stress. It's up here. He said, I only do the downstream work. But upstream work is people like you. It's the stress. What are you going to do now? It's the mind. Can you do something to the mind? Can you think of some ideas that is wonderful, that you can change people's life? So these are things that we should be thinking about. I don't know all the answers. I'm hoping that we can get enough people here in Singapore even from region itself, and come together and rethink our areas of research and think of new ideas, new policies, new techniques, and hopefully we can translate it into the community, and hopefully the people and community will have an undefeated mind. Thank you.
And they did some parallel experiment. They used a brush to brush the pup's bottom for 45 minutes a day. They say they produce the same effect. So why? Some people say maybe mother can be substituted by a brush. Just very quickly, allow me to just go through some of these slides. I don't want to take up too much of the time because we have a Q&A session. Another interesting understanding is what Prof has also mentioned, the hypothalamus, the pituitary, and the adrenal axis. This is an axis that hormones of our body interact with each other to regulate the stress response. The endpoint is essentially adrenal gland just above our kidney essentially secretes cortisol, one of the hormone, a stress hormone. So when you are more stressed, the cortisol level is higher. So at night when we sleep, actually the level drops almost like 80-90% because we are supposed to be most relaxed. Except those of you all who are sitting for exam or going to a job interview tomorrow. So essentially what they found is that this HPA axis so-called is an important regulation of stress. And for young children or in the animal study, they found that the HPA axis is like, because of the plasticity of the neural system, they are able to mold and shape the response system so that the young animals are able to respond more positively with frequent, small, low level of stress. And this is the point I want to drive at, is that stressful experiences are important, especially if they are challenging but not overwhelming, because it promotes development of arousal, regulation, and resilience. And so for a child, for adolescent, coping with early life stresses successfully actually allows them to build their resilience. And we call this, the scientists normally call this early life stress inoculation. They have shown that the cortisol level, the stress hormone actually lower, the anxiety is lower, the individual animal is more prone to explore novel situation or new situation. And what is useful is this part where actually when they sacrifice the animal and study, they find that actually there is increase in the brain volume. And the brain volume is increased, attributed to increase in the white matter myelination. Myelin is a kind of fatty substance that coats the nerves. And with the coating, actually it allows the nerve impulse to move much faster, more effectively. So they find that with all this early exposure of challenging scenario or situation without overwhelming the animal, actually increase the brain matter size as well as more coating of the myelin. All right. So these are interesting, important findings for us to understand why sometimes people believe that exposing our children, our young people with small amount of stress cumulatively without overwhelming them, actually it can be a positive, resilient training process, and so-called stress inoculation. All right. The last two slides I just want to touch upon is really rats and men, the mothering. I mentioned about the mothering of the rat. What is important is that the maternal care during the infancy period serves to program the behavioral response to stress, and it alters the development of neural system. Like I said, the coding, the changing of the circuit, because the brain is very plastic at the early phase of life. So really it's something that is not just a hypothesis, but we have found evidence in the animal study. Last part is the emotionality and self-regulation. This is the part that I think leads to the next few seminars about the mindfulness. At the end of the day, research has clearly found that negative emotionality predict adjustment problem, whereas positive emotionality obviously predict positive adjustment. And self-regulation has been identified in various research to signify that this is an important protective factor to moderate the association of risk versus adjustment or positive outcome. Okay, so I think basically this is what I've listed as a key phases, critical phases of our life trajectory. Some of us, the faculty, we have to work with 18, 19-year-old students. They are just entering this point of their life. Some of us, in my previous job, we have to deal with national servicemen. Actually, today my son just reported for national service medical examination. So this is another important life trajectory milestone for them. And of course, first job experience, many of you have experienced that. And each of these phases actually are challenges. And how do we manage it successfully and achieve a good positive outcome versus being overwhelmed is an important point as part of the effort to promote campus mental health. And if anything, we really want to influence, the component influence, the temperament of the child and our own temperament, emotional regulation, as well as providing a nurturing environment. And nurturing environment is very important. That can come from mentoring if you are faculty, mentoring if you are a supervisor to your colleague, as well as mentoring or nurturing parents when you're at home. So I'll just close with this quote from Cynthia Buchan-Bello. These trying times demand it. No halcyon days ahead, but all hard work brings profit. Stand out and refuse to that. As a diamond remains a stone, without the drill and the cutting, pleasures based on wealth alone robs man the chance of persevering. So, like what Prof Kua said, it will be poor. True measures of success in life is hinged on wisdom and on prudence, courage, patience through the strife, facing hardship with resilience. For out of adversity's crucible comes strength of character and will, and a man discovers he is able to reach his goals and his dreams fulfilled. So with this, I thank you for your attention.